Hi, welcome to the ultimate hub for pet health essentials. My name is Dr Enrico and I've got my little assistant here, Soba, and today we'll be talking about the grand health secrets for senior pets. So, well, it depends because different animals, they age differently. Dogs and cats will age differently, and especially if we're talking about dogs, it depends on the size of the animal. So if you have a large breed animal, a large dog, they will be considered mature at around 5 years of age, and they will be considered senior already around 7 to 8 years of age. Whilst we're having a middle, kind of middle of the range breed, then you're looking at a mature dog around 7 years of age and then senior around 10 years of age. Whilst the dogs, like little Soba, smaller dogs, you would consider them senior, mature at around 10 years of age and then senior later on when they're 12. So it depends. For cats, it's a little bit more kind of standard because cats tend to be similar size, although some breeds are a little bit bigger, but the same principle applies. So roughly you would say they are mature around 6 or 7 years old and senior around over 7, so 8, 9 or 10 years old. Well, senior pets do need a little bit more of a thorough examination when they come to the vet. So on top of that, obviously a full hands-on examination when we check everything. We check the ears, we check the eyes, we check the mouth very thoroughly for dental disease, we check the heart and we check the abdomen very gently. But we would recommend to also include some more diagnostic investigation when we look after senior pets when they come to the vets. So something like a blood test would be very, very important to check for early signs, for example, of kidney disease or liver disease. Also a urine test, that would be very, very useful, again, for looking at general urinary tract health, but also to look for early signs of kidney disease or even liver disease or other conditions that are more likely to affect an older animal. And in some cases also a fecal analysis would be important just to make sure that we rule out those parasites that can affect the gastrointestinal tract. So with our senior pets, we need to be a little bit more careful to make sure that they have all their need in the house and in the place where they live. So for example, we need to make sure they always have plenty of areas where they can rest, so peace and quiet, without being disturbed by, other animals in the house that might be a little bit younger, or children, for example. For all the cats, we need to make sure that they have easy access to the food, so making sure we don't put it in, higher up. If when they're young, they can jump easily. When they're older, they might struggle a little bit more, so we need to make sure that food is, food and water is easily to reach, and more than one litter tray in the house, so that they can easily go to the toilet. Then it's important to make sure that we provide the right diet for them. When they're older, they need a little bit more extra care. So for example, things like antioxidants in the diets, so specific diets for senior pets, they tend to be enriched with antioxidants like vitamin C, vitamin E, also joint supplements, glucosamine, chondroitin sulfate that can help the health of the joint, and also essential fatty acid, omega-3 and omega-6 for the health of the skin. And then let's not forget, some of our older patients will probably have some chronic conditions like chronic kidney failure, kidney disease, liver disease. So some of them might require specific prescription diets tailored to the disease that is affecting them. So when we interact with our senior pets, we need to be a little bit more mindful. Like with people, when we age, we become a little bit more grumpy, and animals might become a little bit, not necessarily grumpy, but need a little bit more extra TLC, tender love and care. So we need to remember to be gentle with them because they can be easily startled by sudden noise and loud noise. So gentle also when we stroke them, when we pet them, because they might have some, little chronic pain here and there that we don't want to make worse by touching them or petting them a little bit too aggressively. We need to make sure, as we said before, that they have plenty of opportunity and places to rest with peace and quiet. So providing them with a safe space, a safe environment where maybe other animals in the house cannot necessarily go and disturb them, or children in the house cannot go and disturb them, so they can get plenty of rest. It's important still to give them the exercise that they need. So let's not forget, they still need to maybe go out, if we're talking about dogs, go for walks, but we need to be more gentle and remember that they might not be able to go as far or as fast as they used to go. So we need to tailor the way we exercise them to their need, and we need to take a watchful eye on their needs. And then finally, we need to remember that they will probably need to go to the vet a little bit more frequently than maybe we used to do when they were younger. Even if they don't tell us that they're feeling unwell, they might still be feeling unwell. So it's important to remember to take them to the vets. Ideally, I usually recommend when they're older, at least once every 6 months, if not at least yearly to the vets, just to have a general checkup, even if they don't show any particular sign of illness or disease. Thank you for watching, everyone. I'm Dr. Enrico, and this was my little assistant Soba. Don't forget to like, subscribe, and share to keep up with vital health tips.